Hi, my name is Sarah Tomlinson and I'm the lead veterinary science expert at AHDB. A very warm welcome to today's webinar. Thank you for joining. I really hope you find today beneficial, and our aim is that you leave today feeling really positive about the situation we're in nationally, and that we are still striving to move Johne's control onwards, and more importantly what you can do with the support of your vet to see the benefits of Johne's control on your own farm. As AHDB, we've had an active role in the Action Johne's group since it started 15 years ago, and the Action Johne's group has been driving improvements in Johne's control and actually driving down the prevalence of Johne's disease on our dairy farms, which we'll hear more about in the webinar today. The Action Johne's group developed the National Johne's Management Plan, which is a framework for farmers and vets to work together to reduce the incidence of Johne's on their farms across England, Scotland and Wales, using one of those 6 control strategies. And today's webinar will cover the latest phase 3 changes. So we've had phase 1, phase 2, and now, because of the success, we are moving on to phase 3. So we've got 2 presentations. They're going to be about 20 minutes each, leaving 20 minutes roughly at the end for a question and answer session. We're going to hear from Pete Orpin and James Hanks, and we'll get Karen Bond to join for that Q&A session at the end. Just a little bit of housekeeping to start with. Your videos will be off and you're muted. We're in control of that, but if we're hoping to run from 5 till about 6:30, but you know, if the questions dry up, we might get finished a little bit earlier. The webinar is being recorded and will be available on the AHDB website and eventually on the Action Johne's website for people to watch. And we hope if you enjoy it, you do share that with colleagues and team members as well, so they can understand where we're coming at with the phase 3 changes. There will be a survey that will pop up at the end. Please do fill that in, because that really does help shape how we deliver these webinars in the future. If you do want to ask questions in the panel, keep thinking about them all the way through. You can add them in the question box. So at the top of your screen, there's a little speech bubble with a question mark in it. Click on that, and then you can type your questions and send them in. If there's a few questions around the same topics, we'll sort of collate them and try and pose those questions for you to the panel. But please do keep them coming in as you think about them through the presentations. So the first presentation is from Pete Orpin, and these will be about the phase 3 changes, what are new in the phase 3, how to get the best out of your data, and importantly, you know, about that relationship with your vet, and helping you achieve those best outcomes for your farm. So Peter is the director of My Healthy Herd, which is an online herd health management tool. And he's also the chair of the Johne's technical group, which is a subgroup that supports the Action Johne's, which is packed with academics and vets who talk about all the latest science to help form what comes through the Action Johne's group. Pete's been a practicing vet for many, many years. He taught me all about herd health planning when I was a recent grad. He's largely retired, but is well known and well respected across the field. And over the years, he's developed a particular interest in the sort of social science of farmer engagement and how to actually achieve behaviour change on farm. And really, Action Johne's was his brainchild. So, Peter, over to you. We can't hear you, Pete, if you're trying to talk. We could see your slides.
Are we there?
We can hear you now, but we can't see your slides anymore.
Okay, sorry about that, guys. Rookie mistake. You'll be with us shortly.
You were too wowed with your own bio, that's what it was.
Well, I don't know about wowed with my bio, but I mean, certainly Now I'm constituting this. So right, let's get back on track. Yes, so very thanks. Apologies for that. Is that the right screen? Everybody's all there?
We
Yep.
can just, that's it, we're there
Yes, I
now.
work with Johne. We're there now. Right. Sorry about that, everybody, just a technical hitch there. I worked in practice for 38 years, and about 25 years ago, I experienced quite a significant problem in one or two herds, and that really captivated my interest and got involved in some in-practice research. And then that went on to help shape the development of My Healthy Herd, which is a web-based program to help with Johne's disease management, amongst other things. And then I got involved in the action group Johne's, and it's been a heck of a journey, to be honest. I've really enjoyed it. It's been a real team effort, and there's been a whole group of organisations that have driven that forward. So it's largely volunteer led. Dairy UK basically are there, and they're the secretariat. BCVA have really helped with all the training. AHDB are providing the support like they are today. And latterly, Livestock have got involved when we've got into this national database. NMR and CIS have been fantastic, and My Healthy Herd, my own company, have obviously been involved too. So back in 2009, we had to sit down and think, well, what is our vision? What do we want to achieve with Johne's disease? And our aim was really to engage all dairy farms in effective Johne's management. And the key was to engage all. Many other countries had programs which just engaged a few farmers and left the majority out. And that was something we felt, as certainly as practitioners, we felt that was totally wrong. And we wanted to create a system where everybody was included. So we had 6 control strategies that you could choose from. The other thing that we thought was very important is that it should be based on a predict and prevent model. It's not just about dealing with diseased herds, because once you've got Johne's disease, you've got quite a job actually dealing with it. So one of the best things you can do is stop it actually coming in the first place. So protecting the uninfected herds is as important as managing the infected ones. And then the last one, and this is something which has been a real lasting theme for the programme, is removing barriers to engagement and to motivate vets and farmers to take positive action. So Johne's disease can only really be controlled by actions you can take on the farm. The vet can help a bit, but at the end of the day, what's really important is what you practically do on farm. Why do we need to work together to control Johne's disease? Why don't we just do it on a farm-by-farm basis? Well, there's 3 strong reasons why we should basically tackle Johne's disease. It is a significant disease which comes up in trade, whether that's trade within the country or between countries, and providing assurances to others. So if you're selling cattle, it's increasingly something which people will ask about. And if we're going to retain competitiveness as a nation, then it's important for us to actually have a system in place. Health is important, significant animal welfare concern for those animals affected. And there's always this question mark about food safety. There's always a bit of a concern that there could be a link between some Johne's disease and human health. It's not proven, but whilst that sort of hangs over the industry, it's another good reason for us to engage. But for you as a farmer, the economic arguments are compelling too. So if your environmental aspects and sustainability and pounds in your pocket, there's strong reasons to get involved in Johne's disease. Indeed, Johne's disease is probably the disease that has the highest carbon footprint of any disease in dairy cattle. So in 2009, we started off with a national programme, and in the early years, it was really broadly an education programme. We educated and trained vets and farmers. And so there was a cohort of vets that were trained. They went out and through milk processors, many of you may have attended those early training back in 2012 to 2014. We took about 3,000 farmers through training at that point, talking about Johne's disease. We started to develop a framework for control. These are the sort of almost like, not rules, they weren't rules because we had no authority to do anything, but it was almost like, if you're going to approach the disease, follow this guidance and you won't go far wrong. And it was so successful, by the time we got to 2020, voluntarily got about 70% of the dairy herds involved in different shapes and sizes to that scheme. Red Tractor adopted it. And so now we have 95% of UK farmers with an annual risk assessment, vet declaration and written control plan. That's really the basis of the NJMP. So our mission, how we're going to achieve our vision, we continue to commit to creating a framework to provide guidance to industry, and providing that consistency and support. We saw that if we all went off in different directions and labs started fighting against each other for business, or vets had one view and then you heard a different conflicting view, everybody would get confused. So we've tried to sort of do everything synchronously, where vets and farmers were all trained at the same time. So already this week we've been doing some training with vets. We had a large webinar about a week ago for the vets, and we've already recorded videos which the vets have to watch and be retrained in before they can actually sign off your plan. So March 31st, which is pretty much today, is the last day of the last scheme. We're now entering the new scheme. So this talk is about what's going to happen in the future. The principle is the farmer pays for advice, and that's been really helpful because it's meant that it's been kept as a secure sort of scheme that isn't dependent on external funds that might come and go. And it's been really well applauded internationally. No other country has done what we have done. No other country has. Most other countries have had episodic activity and then it's crashed and burned and then the whole scheme's fragmented again. But we've actually developed a scheme which is really well regarded. The process for involvement really is encouraging compliance and supporting the NGMP, make a small contribution into the scheme, and that combined with some of the AHDB and other in-kind contribution from all the other sort of contributors, that's how the scheme runs. However, we found after running the scheme for about 10 years, we're going to conferences and saying, look, we're doing a great job here. We've got lots of different farmers committing, but we had no way of quantifying progress. Most of the international programs could at least, this is what we've got, this is the prevalence, this is what we've done. Well, we had none of that. We'd set about using 6 control strategies and we wanted to keep those, but it's actually quite tricky when you've got 6 different control strategies to find a way of tracking progress. So we had to find a way of dealing with that. We didn't want to abandon that. We didn't want to sort of push everybody into one scheme. We wanted to retain that flexibility. The quarterly testing programs, where the herdwise type systems were developed for control purposes, really. We're testing for control reasons rather than surveillance. So we hadn't really set them up with that in mind. We were talking about red and amber cows. We weren't sort of saying what percentage were positive or negative. So how could we track progress within our flexible framework? Well, one option we could have done, we could have said, okay, well, let's just count the red cows, or let's count the amber cows, or the test positive cows, or whatever. And we were nervous about that because if we just track red cows, for instance, and said we want nationally for nobody to have more than X% red cows, there's a risk that farmers just actually remove some of those red cows to stay below the target threshold, but they don't actually totally control the disease. And we found by doing some further research and analysis and looking at the data more carefully, there was a better way of doing it. So what we've also found is that in many other programs, all that happened, the data would go into a central computer somewhere, and it's like a black box. The farmer never benefited from it. We said, well, there's little point of us capturing this data and then the farmer and vet not seeing it. So we think, well, could we develop some new useful key performance indicators which could track and measure the progress of the herd in a consistent, useful way? And could we feed that back to the farmers and vets to make them more motivated and engaged? And that's the sort of like the idea behind the Johne's tracker. Could we use the same definitions and computer code for each milk recording organisation? So if somebody went from one organisation to another, we would have some sort of consistency. We've achieved that in part, but we've achieved that in the majority. If we did that, we'd encourage farmers and vets to become more familiar with those new and accepted standards of how to measure the disease, and that would provide the basis for these parameters to be anonymized and captured centrally. So the tracker data that James is going to talk about after this talk, we have no idea what herds they are. We just get the numbers coming in. We've got no idea what the herds are. So everything's completely anonymized at the milk recording organization level, before it goes into pan livestock. So the information we'll talk about today and all the graphs and whatever, we have no idea what those herds are. But it does allow us to actually do a lot of analysis on, for instance, economics and performance, and produce a lot of the graphs. And ultimately, and this might come in the years ahead, if there was an industry requirement for risk-based trading or providing more confidence in our dairy products to third parties, other farmers, or other countries, we would have a system in place. So we set it up using a model, and this is a model called the epidemiologist bathtub, and it's something that applies to any disease. So if we sort of think, well, how much water is in the bath? Well, that's really controlled by the new infections that are coming in, which is coming in from the tap. So new cases coming in. Then we could also empty the bath through the plug hole by mortality, animals dying, and obviously that would reduce the prevalence. And then we have recovery, which is almost like the loss of heat from the bath sort of thing. So that was the sort of kind of principle that we used. It was an accepted scientific principle, but we took it a stage further and developed a system of measurement, which I think is really good now. And so this aspect of what's a new infection, we found that the amber cow, the J4 cow, was a very good indication of a new cow coming through. And that disease progression is triggered by stress, or potentially having a TB test, or decreased immunity, or strain type of dose, or genetic susceptibility. There's a number of things that influence how quickly the disease progresses in the herd, but we could now measure that. We could measure persistence, which is how long a farmer retained a test positive cow, the proportion of red cows within the herd. And we could also look at how many potentially high test positive animals there. And that could be a measure we could look at. We could look at the management effects, and we could look at the relative risk of removing heavy shedding cows and test positive cows. And so by actually then looking at also things like breeding decisions, the willingness of a farmer to serve a red or positive cow, could actually then start thinking, well, hang on, where is the farmer going wrong? Where is the things that the farmer's doing right? And we can actually sort of feed that back. And so James will talk about that in a lot more detail in his presentation, but that's the principle behind it. So anyway, what's different with the phase 3? Well, there's 4 areas that have changed. They're subtle but important. We now use the average test value to track progress in quarterly testing herds. And the beauty of this measure is that it measures all the data within the herd. It doesn't just measure red cows, for instance. We've now established also a Johne's control index, or a fixed target that the industry can aim for. And this would be really helpful for you, because you'll know, well, in terms of actually getting to a position of good control, we've now got a fixed target. So that's very similar to like a cell count. We know when you get to 150,000 or 200,000, you've got to a position of acceptable control. And we've actually sort of fixed that there. James is going to talk also about benchmark rebasing, about the tracker and the color changes in the tracker. So he'll cover that in his presentation. I'm also going to talk about the random 60 cow sample as an estimate of the average test value, because we needed to find a way of measuring what the level was in herds that weren't doing annual testing or quarterly testing. And this was the minimum number of samples we could do, which would give us an estimate of average test value. So we're no longer using a 30 cow screen, we're now moving to a 60 cow sampling, and that sampling has to be done randomly, and I'll talk about that. And then we've also strengthened the declarations, and we've actually sort of made those more relevant and purposeful. The basis behind the scheme, though, hasn't changed. So know your Johne's disease risks. That's a core part of what you have to do. So if you want to control Johne's disease and achieve the national target by 2030, you need to start managing the risks now if you're not already doing so. And that structured risk assessment is a real predictor of the future. If you do that well, then you will actually get good control. We've just done some work within My Healthy Herd. We've looked at a lot of data of herds that have gone through this risk assessment in the last sort of 2 or 3 years. And a third of the herds are struggling with segregation of test positive animals, for instance. And we know that 2/3 are struggling with, for instance, the identification of red calves and perhaps not segregating those from the green calves. So there's still some work to be done. So that's the area that we'd like you to focus on. We also want you to know your disease status, and this is where we're moving away from the 30 cow screen into the 60 cow screen. And then the written disease management plan remains the same, but we're obviously expecting you to actually put in some smart targets into your declarations. So what are the objectives of the National Earnings Management Plan? It's still a framework. We're here to help you. That's the purpose of the National Earnings Management Plan. We're not here to police you. We're here to provide guidance and targets to aim for, but they're voluntary targets. You know, we're just saying, well, this is what I think the industry should be, the direction the industry should be going in. And if we provide that help to both the industry and the vets and the farmers synchronously, I think we'll end up in a good place. But the big change we've made is to control and reduce the incidence of Johne's disease in dairy cattle with the aim of achieving a national mean average test value of less than 5.5 by 2030. Now, what that means is that we look at all the herds and say, well, okay, we look at all the herds that have been tested, and we want to create an average of those and say, well, okay, what is happening nationally? And that, for us, that's quite important. But for you as an individual farmer, if you get to a position where you're below 5.5, you're going to be in a good place. You're going to have good control of Johne's disease. It's going to be a minor nuisance to you. Economically, you'll have it pretty well nailed. We accept that control will vary according to your aspirations and indeed the aspirations of your processor or your retailer. We're not going to mess with that. So, you know, retailers and processors will have their own particular, you know, requests from you, and you'll have your own sort of views you'd like to take forward as well. So if you want to exceed any of the standards we set, and if you wanted to say, well, I don't want to do 60 cows, I want to do 100 cows, that's all fine. We'll just basically define the minimum that you should do. And we're actually now in a position where we can provide a good method of tracking progress with control at both national milk pool practice and farm level. So we're super happy we've got here. So what's changed then? Just to sort of put more sort of meat on the bones. Why have we done the average test value? Well, any of you who've worked with Johne's disease, you'll know that animals fluctuate in and out of test positivity. You get some that progress, some that don't progress. You get some that actually remain inconclusive most of their lives. So it's not a binary disease. It's not a yes/no disease. You know, some diseases are yes/no. You've either got like BBD, you've got a PI or you haven't. Well, it's not like that. So using the average test value, it's a continuous variable that measures how much Johne's is in your herd. It measures all the data within the herd. And it moves the focus away from this binary thinking. So if you want to reduce your average test value, you have to do more than just kill a non-cow at lower threshold. You've got to switch off the tap. And we've got good data to suggest that if you want to actually make a real difference, you've got to switch the tap off. The herds that switch the tap off get good risk assessments in place and stop calves getting infected, control the disease, and their average test value falls away. The beauty of ATV is we can also use it in the quarterly whole herd testing, annual whole herd testing, and also in any other herd that is a 60 cow random screen. What you'll find with your average test value as well is your high teeter cows, those ones that are clinically affected or approaching clinical, or your priority culls, they're really going to drive up your average test value. So we would advise you to remove priority culls promptly. If you do, your average test value will go down, but also it'll reduce the level of infection load within your herd, and it's going to make it much more likely that your plan will work. The number of low test positive and inconclusive cows also impact on the average test value. So if you're an infected herd today and you remove all your positive cows, you'll still have a slightly high average test value because of the fact that you've got these animals coming through the system that have yet to sort of develop the disease. And that risk of shedding is a real pyramid. That triangle doesn't do it justice. I mean, there's little point just removing non-progressive red cows when you've actually got these priority culls at the top, which we're chucking out billions of MAP. So some of those cows at the top of the tree could be shedding 2,000 times higher than the ones at the bottom that are testing positive. So remove the right cows. And so we've gone through this ad infinitum with the vets in the recent training and sort of saying, look, really focus on your priority culls, because that's where you'll get some great gains in terms of control. How does the average test value vary? Well, if you rank all the herds from the best to the worst, this is what you find. So the top quartile herds now have an average test value less than 4.5, and the bottom quartile herds have an average test value greater than 7.5. But you can clearly see there's a real right skew to the data set. Probably the worst 5% of the herds are the ones that have probably got about 90% of the MAP, or Johne's disease, in the country. So that's where the infection is residing. So we're trying to work very hard with vets and farmers to make sure that we get the best advice into these herds, because these herds have the risk of essentially dispersing it amongst the other herds if we're not careful. So if we want to actually control the disease, we've really got to focus our efforts in that worst quartile. Thanks to the work that Pan Livestock and Emma Holt and James Hanks and Nick Taylor have done, they've done some fantastic work above and beyond their contract, basically looking at where the infection is. And you can see on the left column, 22, that represents, the worst quartile is 22% of all cows. And those 22% of all cows basically contribute over half of the animals that are testing positive, and certainly over half, nearly 60% of the cows testing positive over 100. So those priority culls and heavily infectious cows are all trapped in these very worst quartile herds. Those herds at the bottom in the dark green, those ones are in a very good place. They've got very few cows which are testing positive, and they're in a good position. So if we're going to measure national progress, what target should we set? And it took us some time to work out what we felt was a fair and reasonable target. And the first thing we did was to actually look at what was the mean average test value within all our herds that we're testing. We looked at the quarterly herds, and you can see from 2015 to 2024, there's been best part of a significant 30% reduction in the average test value. It's gone from over 10. Back in 2015, it was averaging over 10. It's now hovering around 6.71. And we did some social science work, and the farmers came back to us and said, look, I hear what you're doing with quartiles, but that puts me in a hamster and a wheel type situation where I'm permanently chasing my tail all the time. We'd much rather have a fixed target. So that's why we've come up with this aspirational target by 2030. That gives you a reasonable target to aim at. The Johne's Control Index, it really sort of ticks the boxes in terms of being a specific, measurable, achievable and realistic target. It respects the limits of sensitivity and specificity. We've set it at 5.5. It means the test prevalence is about 2%. So it basically means that you don't have to eradicate the disease, you just have to get it to a position of good. And it avoids farmers and vets pursuing eradication. Trying to do that with a ELISA test is quite tricky. It's quite a tricky thing to do. And it would be very tricky within our framework to do. And you'd have to sort of very intensively test and perhaps use other tests alongside it to fully eradicate the disease. And the beauty of this JCI is we can actually use it in all the data sets that we've got. Is it achievable? Well, 41% of herds are achieving it right now. So yes, it is achievable. So it's not as tight as top quartile, but 40% of herds are already getting there. Now, I'd like to think that with some effort over the next 5 years, we could probably push that up to 60%. That would be absolutely fantastic if we could actually increase the number of herds that are in a position where they've got good control of the disease. Because once they're in a position of good, then they're happy. They're generally happy because they've got very little economic impact. I haven't got time today to show you all the data. What we can see is that when you get to the position of being good, a lot of things are in the green. You're in a really good position. And those herds, once they get below 5.5, the new infection rate is normally low, the priority calls are largely absent, and the disease becomes a minor nuisance. And it's a really, really good position to get in. And we've done some analysis that if you go for, say, 3 or 4 years below 5.5, the prediction is the following year you're 90% likely to be in that below 5.5 the following year. So once you get into the habit of being below 5.5, put all those controls in place, you generally stay there. So the benefits of that target: it provides a clear target to aim for. It equates to that 2% prevalence. So we're not pursuing eradication or perfection here. At this level, the disease is well controlled. And some farmers would actually start saying, well, we now move from test and manage to test and cull. We're more likely to cull them than we are to manage them. And we will certainly be happy. You yourself as a farmer will be happy when you get there. Okay, so the random 60 cow ELISA sample. So in the past, we asked you to do a targeted screen. We asked you to hunt out the high-risk animals. Now we're going the other way. We want you to do things completely randomly, and that allows us to estimate an average test value for your herd. Why didn't we choose whole herd testing as the minimum? We had quite a lot of pressure from some quarters to say the minimum requirement to be in our program, our framework, would be a whole herd test. Well, 10 or 15% of herds are flying herds, for instance. I think there's about 800 of them that are in that position. Now, I think they would balk at actually being asked to do a whole herd test when at the end of the day, that wasn't something which was important to their business model. We also felt there wasn't any evidence that more testing would create lasting engagement. So simply throwing more tests at farmers doesn't make them control Johne's any better necessarily. They should, if they use the data, should be better. But just asking people to do more testing alone without actually getting them into a position where they're enthusiastic about control, it doesn't work. So we wanted minimum surveillance to achieve the aims, and that's what we found is going to work, I'm sure. So the purpose and logic of that random 60 cow screen: it provides an estimate. It's just an estimate of your average test value. It will give you an idea as to roughly what ballpark your herd sits in. It'll provide a springboard for further discussion and engagement. It's pretty low cost, to be honest. The additional cost probably is about £60–70 a herd rather than a 30 cow screen. So it's not a massive ask of the industry. But I think, it's certainly not as great as a herd test, but we do feel it's not going to dissuade anybody from doing it. And if you think you want to have a more accurate sample and do more testing, and you're discussing with your vet, you're a large herd, you might want to do 100 tests or whatever, by all means do. But statistically, 60 cows is pretty reasonable for any size herd. It will give you a reasonable result. How do you select randomly for proper estimates? The vets have been advised how best to do it, but in principle, what you do is you start randomly. If you're asked to test, for instance, every fourth animal in your herd, if you've got a 240 cow herd, you might be asked to test every fourth animal to get your 60 samples. You're asked to perhaps ask somebody to say, well, okay, for the first, pick a number between 1 and 4. Okay, 3. Well, you'd start with the 3rd cow in the parlour, and then you'd have the 7th cow in the parlour, and then the 11th cow in the parlour. That's how the testing frequency would actually work. So any farmer already performing a whole herd test or quarterly test will already have an average test value. So really, the 60 cow random screen only really applies for herds that are not doing whole herd testing as a minimum. We've made some improvements to the declaration. We've included smart targets for priority setting. So what we want is for you to actually sort of put slightly firmer targets in there to make sure that you can hold yourself to account, really. And these are targets that you and your vet are going to agree. It's nothing to do with us, what you put down there, but we'll give you some examples of the type of targets which might be appropriate. So the sort of things that you're looking at are high-level targets. Well, we must do another detailed risk assessment, for instance, to make sure that we haven't got any areas we've missed out. We must do some further training for all the farm staff to make sure they understand what's going on, or specific areas of the plan that need attention. It could be, well, hang on, we haven't quite nailed identification, or we haven't quite nailed segregation of the cows or the red calves. That's an area we need to look at. Or perhaps looking at the frequency of vet review. If you've got a reasonably high prevalence, is it sensible to just have one review per year? There's nothing magical about a year. You may want to actually make sure you're reviewing that more frequently to make sure that you're actually going to have a plan that's going to work and pay dividends for you in the future. So, and we've gone through these sort of things with the vets, so they're aware of it, and they will be working with you to sort out those agreed targets between you and your own vet. On your declaration, you'll also be asked to put an average test value. If you didn't have one for last year, obviously you have to leave that blank. But for this year, you would be asked to put that in. And you'd also want to actually put in the biosecurity protect and monitor what sort of strategy you're on. Are you improved farm management or strategic testing? That's the same as what it's always been. So there's no real change to it apart from that. And you're also asked to select what your surveillance strategy is, whether it's whole herd test or a random 60 cow sample. We won't get access to any of this information. It's not for us to look at. We will get that indirectly through the anonymized data, but we won't have any understanding of your individual results at all. So that benefits of that declaration hopefully provides an opportunity to review progress and celebrate success. So in many herds, a lot of herds are improving quite quickly. So it should be a situation where it's an opportunity to pat your staff on the back rather than actually get despondent. And it allows you to also optimize your plan and make sure you're on track to achieve your targets, because the problem with Johne's disease, if it goes wrong, you don't find out until 3 or 4 years down the track that it's gone wrong. So you want to actually make sure you're doing everything possible now so that you're going to be in the right position in the years ahead. And this focus point, this discussion between vet and farmer, I can't stress how important that is. We've looked at data from practices, and some practices have got more enthusiastic about Johne's than others. And, if you can actually get hitched up with this enthusiastic vet in your practice that is really keen on Johne's disease, they're the one that quite often will go the extra mile for you. It may not be the vet that routinely comes to your farm. It could be one of the other vets that is really keen on Johne's disease that comes along and does your assessment. We need that. We need an ATV, so we need the 60 cow random screen. We do have firmer actions with the smart targets, and we're seeking to sort of drive agreed change. We want you to sort of commit rather than just tick boxes. It's not something you want to do just before 2 days before your red tractor, amongst all the other things. Sign your declaration. That's not the way to sort Johne's out. If you follow that mentality in 2030, you may be in the worst quartile. So you don't want to be in that position. So just to summarize, we found that basically the best way to switch this disease off is to actually turn that tap to make sure you protect the calf, stop them getting infected. Again and again, we look at the data, and that's what we found. Simply focusing on culling Johne's cows, it's an expensive game and it's less effective, and you won't achieve your aspiration of 5.5 just by culling, because you keep on getting cows coming through all the time, and it's a very expensive way of doing it. So if we want to empty the Johne's disease sink, you've got to reduce the risk of new infections. You've got to limit the Johne's disease persistence through removing the right cows and culling those priority cows, and trying to decrease disease pressure through selective breeding as well. So just a summary, the long-term objectives of the UK National Johne's Management Plan, we're here to help you. If there's any areas of concern, ping them through to the action group Johne's. We certainly want to hear about them, because we'll try and find a solution for you. We're aiming to control and reduce incidence of Johne's disease in dairy cattle with the aim of achieving a national mean average test value of less than 5.5 by 2030. So that's completes my presentation, Sarah.
Brilliant, thank you, Pete. Please do keep sending questions in. A few of them are coming in and we're collating them, and there's no such thing as a stupid question. If you're thinking about it, other people will be too, so don't be frightened to put those questions in. We won't put names next to them, so no one will know who's asked which question anyway. Thank you very much, Pete, and we'll move on to James now. If you want to get your slides up, James, that would be good. James will kind of carry on from where Pete left off, really talking about the data we've got and the progress we've made so far, and sharing his insights from that tracker data at Interherd Plus, and potentially cover the changes that you will see in your reports, going forward. James is the director of Pan Livestock Services, as Pete said, and Pan are our livestock data specialist company who do an awful lot of work with Interherd and Interherd Plus, and they also set up the Johne's tracker and the Johne's tracker database. James is absolutely a data specialist who does an awful lot of work for the Action Johne's group, and making sure we are aware of the progress that is being made through vets and farmers working together, and trying to encourage people to make the best use of that data, I suppose, isn't it, James? So over to you.
Okay, thanks Sarah. So yes, Pan Livestock, we've been involved for about 7 or 8 years now, I think, with the action group Johne's, looking particularly at the disease, the data aspects of the program program. Pete's already talked about parameters, and without going into any great depth, but the way we're measuring the disease and the progress of the disease, we've got to have parameters to work with. And he's talked about the average test value, which, if you like, is a good indicator of the level of disease in the herd. We also, because it's a continuous variable, we can also look at the number of cows in your herd that are testing positive if we have a cutoff at 30 or 60 or 100. So that, if you like, is a measure of the severity of the disease in your herd. We also have, when Pete talks about turning off the tap, he's talking about stopping the level of new infections. So cows showing that first positive test, cows that we thought were negative or J0, suddenly break down and become they've had a positive result at 30 or higher. So that's the J4 new infection rate. And then another parameter, set of parameters that we've developed are more concerned with the management response. So how does the farmer respond to knowing, as far as serving a J5 cow or removing a J5 cow compared to a cow that they don't know has got the disease? So these are all key parameters that give us an idea of the level of the disease, the severity, and all these other things. So unless you're colorblind, you'll see that they also come with a color. And basically these colors tell us whether the value that you see is very good, in which case it's in the dark green, it's got a dark green background, or pretty poor, which is would tell us it's got the red background, the pink background. This is really important. We're not just looking at the latest test results, this last set of results. We want to look, we've got a huge amount of data going back. If you've been testing for a while, you've got data going back a long time, and it's really important that we make the most of it. We want to look at what's the difference now in 2024 to what was going on in 2019. And we have these colors telling us that you were in the worst quartile and now you're in getting into the best quartile or whatever, then that becomes really useful as far as making decisions in the future are concerned. So where did we get these colors from? Well, this is the first problem we've got to rectify now, because when we started this whole process, the only database we had with a significant amount of Johne's data in it was the 500 herds that we use with NMR to produce KPIs of performance, fertility, health, and so on every year. So in 2020, we had of those 500 herds then, about half of them, 253 of them, had also been testing for Johnes for a considerable amount of time. So we were able to use their data, and that's essentially, you get the idea of a quartile. So a quarter of them, we put the individual, the 250 herds in ascending order from the best on the left to the worst on the right, and then a quarter of them will be dark green because they're in the top quarter, a quarter of them will be red because they're in the worst quarter, and everything in between. And so it's important to note that when we started this in 2020, we were dealing with 253 herds, that's all. Yeah, and the figure was 7.54, put you in that top quartile. Things have changed since then, and we're now in 2024, and Pete was talking about the National Johnes Tracker database, which is a phenomenal resource that we're only just beginning to get to grips with now. It's essentially, it's about 2,500 herds, but as far as the figures I'm going to talk about, we're talking about something in the region of 1,800. 1,900. These are the herds that have tested 4 or more times in 2024. So this is all the quarterly testing herds from NMR and CIS. We don't have a clue who any of them are. It is completely anonymized before we get our hands on it. But this is a very, very good picture. There won't be a better database in the world as far as the spread of Johnes disease across a large population of herds. And do note, Pete, as Pete says, there's this enormous sort of ski jump at the end where we get a lot of, it's not a uniform distribution at all. So the problem is now is that with those 1898 herds that we've got, the average test value now, so we were starting again today, to be in the top quartile, so to have a dark green background, you would have an average test value of 4.5, whereas we were using 7.5 from the data in 2020. So obviously we've got to make an adjustment to allow for this, and I'll come back to that in a moment. But this is the problem we have it's the result of the phenomenal progress that we've made as an industry. 3 and 4 herds that have been testing in that database of 2,000 herds. 3 out of 4 of them have improved their average test value. So the level of the disease has come down, and in many it's come down very significantly since 2020. I won't bore you with figures, but there is a definite trend. It doesn't matter what we look at. The average test value, if you look at the median value here, this yellow one here, where we are now is much, much better than where we were 10 years ago. We also have been, since 2020, we've been having a good, steady progress. This is since the introduction of the Johnes Tracker. Year on year, each of these parameters is improving, but we get, in the last year, if anything, it's flattened out or deteriorating slightly. So we're a bit concerned that we're losing momentum, if you like, and we need to refocus everybody on this in the future. So, and it doesn't, all the parameters show the same general trend. So whether, the severity parameters, the priority culls, and the J4s, J5s, much less than they were in 2015 and less than they were in 2020, but beginning to flatten out. So enough on figures. The trouble now, because of this problem with the improvement, if we use the data at the moment, it looks like 3/4 of the herds out there, 75% of herds out there, are currently, if we look at the average test value, in that top quartile. And the reason for this is because we're using, this is the 2024 data, but this is the target coming from 2020. So instead of reaching the 25% of the herds, it's reaching it right up here. So this is why 3/4 of the herds think they're doing much better than they actually are. They may be improving, but it's your improvement relative to the other farms in the population. So what we're going to do as of tomorrow, I guess, is we're going to reset these parameters, these colors, not the parameters, the colors. The parameters will stay the same. The colors will change, and this will happen annually. So we won't have this sort of sudden jump that we're going to have this year, but we're going to take the average of the whatever parameter it is, the average of the last 3 years, and use that. So we will get a gradual change in future years. So enough on that. But what's that going to look like as far as a farmer is concerned? So if you're receiving your tracker results at the moment or whatever, you can see this herd was making good progress. You've still got the values, but this is using the data, the targets from 2020. So when we change them to 2024, The values will not change. Everything is exactly the same, but the colors will, because we're using the more up-to-date parameters, the more up-to-date data to do that. The story won't change either. This is a typical herd. They had problems, and they've moved from the worst quartile to one of the better quartiles, and now they're in the top quartile. And as Pete talks about turning off the tap, that's this J4. You can see they were all over the place. They had lots of cows coming in with breaking down with infection. They turned the tap off at this point here, very low levels, and the average test value has fallen away ever since then. So just to if I go back one, I can't do it. No, I'm going the wrong way. I'm sorry. Let me go back up. Yeah, so that's where we are now. It will change very slightly, but don't worry about it. Just don't be spooked by it, please. So the other problem we're very aware of, and Pete has mentioned as well, is that the concentration of problem cows or Johne's cows in the different quartiles of the herd. In fact, if we look at herds in the quartile 4, there are 7 cows testing positive at 30 in those herds for every one that you will find in this best quartile. So obviously, if we put as much work into halving the infection rate in the top quartiles, we're going to have very little impact. But if we can halve the number of those farms, those cows in the worst quartile, then we're going to make real progress with this disease. So most of the map is in this worst quartile, particularly in these herds in the worst, at the very right hand side there. And how do we engage with those? How do we make progress with those? Pete's already talked about these, but basically, you've got 50% or more, 50 to 60% of the problems, whether you look at 30, testing positive at 30, 60, 100, 5, J5s or whatever, are in that worst quartile. 80% of them are in the worst half, as a rough and ready picture. So what does that mean if we can move you from quartile 4 to quartile 1? Based on the large database, national database that we have now, that you've got an average herd size of 240. So they will have on average 15 cows testing positive at 30, whereas in the other, the quartile 1 herds will have 2. So there's massive differences. Effectively, whichever group you look at, you end up, once you're in the quartile 1, you've got about 10% of the problem cows that you've got when you're in quartile 4. So it moves from being an all-embracing, all-encompassing problem to a bit of a minor irritation, and that's what we want to get people to move towards. Now, Emma Holt and Nick Taylor have done a lot of work on. It hasn't been published yet, but it's coming because we've got this database which tells us what's happening in all those herds. We can see what impact does a change in the average test value have as far as milk production, as far as cell count, as far as fertility, and so on and so forth. And the key ones are the milk output. For every unit of average test value you can get down, the milk output per cow per year is increasing by over 100 kilos of milk, so about 112. The cell count will also come down. So very, very roughly, based only on the milk production, if you can move from quartile 4 to quartile 3, you're typically going to be looking at something in the region of a £35,000 more money income from milk produced, the extra milk production in the herd. And quartile 4, you're talking about 50,000. So we're talking about big sums of money. But please, I emphasise this is only based on the improvements in milk per cow per year. What impact this will have on carbon and all these other things, that's to be worked out in future. So how do we start? What do we do? As a farmer, the first thing you've got to do is make sure that you have a good partnership with your vet. And I say partnership because this has got to be a combined effort. A vet won't be able to sort it out for you if you don't cooperate, and vice versa. It's got to be both working together. Every herd is different. There will be different case studies. Every herd should be treated as a separate case study, and it's really important that the control will take time. You've got to work together and come to
Thanks, James. Keep putting your questions in. We've got quite a few coming through. I'm going to sort of start at the beginning. Some of them, I think the questions have been slightly covered in the presentations, but I think it's not a bad thing to reiterate some of those questions. I think just to summarise for me, we're making amazing progress, aren't we? And this is about keeping that momentum going. There will be changes to what your data looks like from the tracker point of view, but the data isn't going to change. It's just the colours, and not be shocked by that. The key point is at the beginning you said, Pete, that the National Johne's Management Plan isn't this one plan fits all, and that this is very much about the vet and farmer working together to produce the best plan for their own business. I'm going to introduce Karen to the panel. Karen is a vet. She is the veterinary technical advisor at NMR. Quite a lot of you might speak to her over the phone. And she is also another Yonis guru and has spent and dedicated quite a lot of her time and career to investigating Yonis and what it means on farm. And she's also, alongside Pete and James, written quite a lot of veterinary training to make sure we're all singing from the same song sheet. So welcome, Karen. So one of the first questions is around, why would I do a whole herd test if 60 cow random screen is enough? Who wants to take that one?
Me to take that?
Okay.
Yeah.
Yeah, so that's one of a really good question, because obviously we have increased the minimum requirement of testing. So we're now not using the 30 cow screen anymore. We are now looking at every herd generating an average test value. So the minimum way to generate that average test value is that 60 cow screen, and that will give you an estimated ATV, and it will give you a reasonable idea of where your herd is, and it will give you the ability over the years to see whether you're making progress in improving Yonis, whether it's staying the same or whether it's getting worse. So it will allow you to track it, and it will also allow us to input that data into our national figure for the country. So that's brilliant. What it won't do, though, is give you individual cow information for all of your cows. So what we have to do is just kind of differentiate between testing for surveillance. So that's testing to say, have I got Yonis in my herd, and give me a reasonable idea of how much there is there. And then there's testing for control. So if what we want to do is use testing and use it strategically to make individual cow decisions, then we need data for every cow. And just doing 60 cows isn't going to give us that. So that's the difference between doing a 60 cow screen and then moving up to a whole herd screen. If you've got Yonis in your herd and you want to do a strategic testing model, so you want to use testing to allow you to implement management decisions, then a 60 cow screen isn't going to cut it for you. You are still going to be looking at whole herd testing.
Thank you, Karen. The next question is again around that sort of 60 cow sample. Can you repeat sort of the why random now and not that specific 30 cow screen that we were doing previously? And how, and the other added onto that, sorry, is, you know, can you repeat how you randomize that selection?
Sure. Yeah, the randomization. I mean, the vets will be trained in terms of how you do it, but in principle, what you want to do is to make sure that you're not skewing your selection in any way. We don't want to. If you skew it in such a way that you try and reduce the average test value, you end up just fooling yourself. You know, that's no point at all. Equally, just looking at just very high risk animals will skew it the other way, and you'll end up having a false result there. So it's important that you randomly select. So we want to get an equal probability of sampling all those cows that are in milk. So if there's 240 cows, we need 60 samples, then basically the maths will be, well, you need to test every fourth cow. And you don't start at the first cow in the parlour, you start at a random number that somebody selects between 1 and 4, and you say, okay, we're starting at cow number 3, therefore the next one will be 4 along, which is now cow number 7 in the parlour, and whatever. And so doing it that way, you'll actually get a reasonably accurate average test value, and it'll be consistent. And we have had some questions sort of saying, well, there is a subtle difference between herd size, but we thought on balance, rather than have a sort of range of samples between 50 and 75, depending on the herd size, we said, well, let's just go with 60. It's much easier for us in terms of simple messaging. It's going to deliver that result that we want without having too much complexity. But if your vet wants to, as Karen says, then, well, in your situation, I think we're better off spending our money doing a whole herd screen, then you go straight to that step. You know, we're not preventing anything. We're just saying, well, this is the basic minimum.
Brill, thank you. One comment in the questions really like the Johne's tracker visual tool. Very good for showing employees where we have come from and reinforcing the importance of protocols everyone carries out daily to achieve this. I think you'll take that, won't you guys? That's exactly what it is designed to do. Yeah, that's brilliant. One question around TB. Does the ATV take into account when the test is taken? Is there any record of how soon after a TB test a Johne's milk test is run? Because if it's very close, the sensitivity will be much higher, making yellows more likely and potentially skewing the result compared to other farms.
That got my name written all over it. Yeah.
So I think the key first part is maybe what impact the TB test can have on the Johne's test, and then also about that, do you take that into account? What advice would you give farmers around that?
Yeah, great question. So there's been quite a bit of research done over the past few years looking at the impact of the TB test on Johne's antibody testing in milk. And we do know that if you test close to a TB test, then we do see an impact in terms of results that you'll get, and you will tend to find more animals testing positive. So what we think is happening is that if you test at the right time, so very close to a TB test, what you're doing is actually picking animals up earlier. So you're kind of priming them with the skin test that you're giving them. Remember, you have the 2 injections. You have the top one, which is bovine tuberculin, and then the bottom one, which is avian, which is very closely related to MAP, which causes Johne's. So we think that injection is stimulating antibody production in animals that actually have Johne's. So like the question said there, we are seeing an increase in sensitivity at that point. Now, the standard advice, and we would still maintain this for the vast majority of herds, is that if you leave a minimum of 6 weeks post-TB test before you do any Johne's milk testing, then you will see very minimal interference with results. So standard advice is always, if you do your TB test today, you want to leave a minimum of 6 weeks before you do your next Johne's milk test. Okay, that is what we still advise. That way you're not going to see any impact. So to avoid what is being asked in the question, best way to do that is to make sure we leave that 6 weeks. And we can do that because remember, our shortest interval for TB testing is going to be 60 days. Often it's 70, 80. So we can fit that testing in around TB testing. And the milk recording organisations are really happy to move your milk recordings around, or if you're doing your own sampling, then obviously you dictate when that's done. So you can make sure that you're leaving that period there. There is some research looking at using the TB test as that primer, but if you're going to do that, that's a conversation to have with your vet, because there are quite specific circumstances where you might want to do it, and it's really important if you're going to do it, you work with your vet, because you're going to need to know how to interpret those results and what to do with them. So as I said, standard advice very much still is we leave that 6 week period. If you do that, then you're not going to have any interference with that ATV.
Currently, Sarah, there's no system at the moment to pull in the TB testing data. Is that correct, Karen? We haven't got a link up there, James, between them. So at the moment, there obviously is. If everybody goes to testing within a week of a TB test, then obviously that will skew the national average test value. So but we haven't currently got a workaround for that. So we have been thinking, well, how much of an issue is this? But if there is something that does become an issue, then we would need to think about how could we do that.
Well, thank you. And I think the key message is the rumour and myth was always actually they were falsely elevated Johne's results, and actually we now understand that that isn't the case. But I guess speak to your vet and speak to your milk recording organisation.
Yeah,
more information.
Definitely speak to your vet, because timing is everything. If you are going to use it close to a TB test, timing is absolutely crucial. So you need to work with your vet to make sure you're doing it at the right time and then interpreting the results correctly.
Well, thank you. This is quite a specific question. In your presentation, Pete, there was a dip in the percent achieving the JCR in 2019 to 21. What do you think was causing that? They've suggested that could it be COVID and that people were just reducing the testing and the sampling and people going out on farm, I guess.
Yeah, I think it's interesting. The ATB is going to sort of fluctuate a bit, and some of that will be altered by things like coal price and milk price and a variety of different things. I mean, the other thing that's happened in recent years, as well as having the Owner's tracker, is the adoption of sex semen, and that's had quite a significant impact. So James has published this, that there's been a rise in the almost like heifer placement rate within herds. So people are actually more likely to breed more replacements and flush out infection. So I think those factors are there. They do, come into play. So I think that's the sort of thing that can happen. But it's important when you're looking at your own data. That's when you're looking at your own data, you do sort of think carefully about what data you're looking at and what changes you made in that particular year, on your own farm for sure.
Thank you. Another one about your presentation, Pete. Are the top 5% worst quartile herds of most infected cows in any way associated with increasing herd population density, i.e. are larger herds more likely to have higher levels of infections?
We've not looked at that, James, but I'd be surprised if they are. I think what seems to happen in the herds, and we haven't done the research, there isn't the research on this top quartile. That's something which we would love to be able to do and answer that question accurately. But is it the farmer doesn't see the importance of the disease, so they're testing but they're not controlling? So it could be it's a belief importance issue. Is it because the farmer is testing but he's not segregating and he's not able to apply the controls? Or is it there is a particular strain type in there that's a real hot strain that's very difficult to control? So there's a variety of potential things that could be playing a part. We know there's also genetic susceptibilities as well. We know certain breed types can be a problem, and we also know that the other things that affect progression can be things that cause immunosuppression, within the herd. So there's a number of reasons that come into play, but we've yet to get funding to answer that question properly.
Thank you. Another question here. How big a risk is calf-to-calf transmission realistically in what you've seen? So I suppose we've identified those high-risk animals. What's the risk when they're in the calf pen?
Yeah, sure. I mean, I think there's gathering evidence that that's an important risk factor, but it's going to follow on in terms of the environmental challenges. So if you're looking to control your disease, if you're not started, you don't start with calf-to-calf transmission. You start with actually segregation of the high-risk cows, hygiene, clean the environment up, creating that green calving line, do all of that sort of early separation of calves from the mother. A lot of herds did that, and they've got completely adequate control with that. But if you end up serving cows which are highly infectious, your priority culls, and those red calves come out, and they themselves potentially highly infectious, they have the ability to infect other replacement calves in the pen. So what we're suggesting is that once you've done all the other stuff, you really want to make sure when you're tightening the screw to then start saying, well, is it worth taking the risk of actually serving a red cow, for instance, and trying to get a replacement calf out of it? Because we know that once that calf is born, it will recirculate and infect its mates. And so, how significant that is relative to all the other risks is going to depend where you are. So in the herds that have just started, it's probably a reasonably small risk. But as you've got a situation, once you've snuffed out all those major risks, you then start thinking, well, why am I still getting cases? Well, it could be through this route. So those herds that have been testing for a reasonable length of time and have still got new infections coming through, then I'd urge you to actually go as far as making sure that those red calves don't go into your green calf pen. And there's lots of different ways that you can achieve that, depending on, whether you're a block calving herd, a whole herd testing one, whatever you're doing, there's lots of different ways, and speak to your vet about that, how best you can manage that risk.
Thank you. A question about different breeds. Are particular breeds, Channel Island breeds, more likely to suffer from Johne's disease? I don't know whether that means test positive or actually progress to clinical Johne's disease.
Well,
Yeah, that's a really good question, because we don't have any evidence that they're more susceptible to it, in that they're more likely to be infected with it, but they do seem to deal with it slightly differently. So it's more the clinical presentation of it that's different, rather than necessarily how susceptible they are to becoming infected in the first place. So whereas with, let's take Holsteins, for example, you'll often see cows go through a quite lengthy period where you're not seeing any clinical signs. So you're not seeing any scour or any weight loss, for example, but you may be seeing the economic and production impacts. So they may be poor yielding, they may be high cell count, more likely to be lame, etc., etc. And in the testing profile, you'll see them having these peaks and troughs of antibodies. So they're your classic cows that might test positive this quarter, maybe negative the next quarter, negative again, and then positive again. So they kind of sit in that sort of second phase of the disease for often years. With the Channel Island breeds, quite often what we see is they go from testing negative and looking absolutely fine to then testing very high positive with increasing teters and going to clinical disease quite quickly. So they almost seem to miss out that middle phase of the disease. So maybe not a susceptibility issue, maybe a how they deal with the infection.
But I just say, in that database we've got now, we have Channel Island breeds as well. So the data is there. We've just got to have a look at it, really. It's but my experience, I mean, I have seen 2 or 3 herds with very high levels that are Channel Island, but I've also seen herds that have sorted themselves out that are, from that position as well. So yeah, it's not a it's a reality.
Yeah, and definitely that doesn't mean that a Channel Island herd can't get on top of Yonis and control it. Absolutely not. We've still got the same mechanisms of spread. We've still got the same management that can be done there. It is that clinical picture that seems to be different.
Yeah, we're seeing also, if you're in a situation where you've got rapid progression, where they test positive and they progress quite rapidly, and that's the norm within your herd, you're better off to say do not serve those cows rather than trying to breed them to terminal sire, because you don't want to get them pregnant, because that causes challenges for you when you try and cull them. So we're now seeing a shift more to do not serve, and the double benefit is that you also don't get a red calf born from them. So as prevalence declines, people move from a test and manage, breeding to terminal sire, then they move to do not serve, and then when the prevalence gets to very low, they then quite often get to a position where they'll say, well, we just have a test and cull. So those are the there's a journey you go on, really, but we would strongly advise you, for instance, not to do a rigorous test and cull regime when you've got high prevalence, because it will be very costly for you. You're better to test and manage and slowly get there. And our evidence has shown that the herds that get the best gains switch off the tap and just have a gentle culling program that culls out the worst cows, and keeps on doing that consistently, and they do all the other risk management, then they get the best outcome.
Often people say as well that the most difficult thing for people to do in their herds is segregate those cows around the time of calving. So if you do have that do not serve policy going on for those cows, then actually you have fewer cows that you're going to have to try to segregate around the time of calving as well. So it does make that aspect of management easier. Sorry, James.
No, I was just going to say, going back to the question of different farms, having different levels of infection. I'm sure just by looking at so many farms, there are hotter strains of in some places than there are in others. We do get herds which the level of Yonis just creeps up slowly, and you get others where the cows are fine, and then suddenly once they get it, they start breaking down. It goes up very high very quickly. So what breed influence that is, or genetic influence that is, we just haven't had a chance to look at it yet, but it would be really interesting to follow up.
Yeah, and that's why, looking forward, I think it's so important that we think about what animals we reintroduce. You don't want to introduce a hot strain into your herd. You don't want to. So I think in the future you'll be able to select herds by saying, if you're going to purchase replacements from herds which have got a proven ability to have a very low prevalence and a very low new infection rate. And I think that will be a much better strategy than just buying random animals and hoping they're going to be okay. because that's where we get the biggest legal claims seem to come from, this purchasing of animals into herds, and then they don't get managed, and then the infection spreads, and one farmer starts to sue another. It's a very difficult situation.
Thank you. Another question, how soon after calving is it safe, or I suppose advisable, to test without the result being affected, especially in heifers?
Yeah, that's a really good question. So although we're able to put milk back into the tank, it still is actually more viscous and still has some colostrum within it. So what we need to do with our milk testing is we actually need to remove the fat from those samples to do the testing. And just because of the viscosity of that fat that's in there, it's really hard during those first few days post calving to effectively remove the fat. So the advice would be not to do any ELISA testing, so that's not just Johne's, but any disease testing on milk within the first 7 days post calving.
Thank you. We've talked about sort of not breeding from those red cows. What are the transmission routes from mother to fetus and to that calf? So I think everyone's aware of the sort of colostrum risk, but what is that transmission in the uterus to the unborn fetus from a positive dam?
I'd like Karen to answer that, because she's done some great work on this dam association. So it's quite a complex area, but take us through it, Karen.
Yeah, so I guess your first question there is around in utero spread, so spread to the fetus before the calf is even born. So there's been quite a lot of work done over the years looking at that. It's obviously quite a difficult thing to demonstrate effectively, but the work that's been out there, they looked at animals that were in that phase that I talked about before, where you're not seeing clinical signs, but you're seeing them being either repeatedly positive or intermittently positive on testing and having those production impacts. And at that stage, they think it's around 1 in 10 calves will be infected in utero before they're born from that dam. If you get towards clinical disease, so if you've got cows that are actually scouring and losing weight, then it's between 2 calves per 10 out of 10 would be infected. So, significantly greater risk. So in utero is definitely an issue there. And again, it comes back to what Pete was talking about, where when you've reduced a lot of your other risk factors, in utero spread might be one of those things that just keeps the infection kind of trickling along within your herd. But the much bigger risk is at the time of calving. So we know that actually it's that fecal oral route, so it's adult cow muck. So muck from infected cows can contain billions of the MAP organism. You saw the slide that Pete put up with the triangle there and showing just how many organisms can be in there. And it's actually the exposure of that calf to that adult cow muck that's the biggest risk. And again, when we think of colostrum and milk, we think of them as being a risk. They in themselves are not a big risk, but it's actually contamination of either the teats or of the milk and colostrum itself with cow muck that's a much bigger risk. What we did see with the work that I did during my research was we looked at the risk that was posed to those calves, and we followed them through, and we tried to decide which were the biggest impacts on whether calves became infected with Johne's. Couple of management things that we saw that are worth mentioning, which was the amount of time that the calf spent in the maternity area. So basically how long it was exposed to adult cows and therefore adult cow muck. So that comes back to Pete's point of getting those calves out quickly and cleanly. And the other one was the cleanliness of the maternity area they were in. So fairly obvious, those two. But what we found was a really big risk was actually the dam's status. Whether that dam had Johne's at the time of giving birth to that calf had a really big impact on whether that calf itself was going to go on and develop Johne's, which again seems pretty obvious. But what we also found was that even a cow that tests negative today and gives birth to a calf, but then goes on to test positive later, actually her calf that was born while she was negative, so before she actually tested positive, was still at a much higher risk of going on to have yonis itself. So we know that that dam to calf risk is big. And again, that comes back to, managing that risk, having those clean areas, getting those calves out quickly, but also then potentially, if you have a cow that goes positive, looking back at the offspring that she's already had that are there in your herd. So tracking back and saying, okay, well, she's already had a heifer calf. I'm going to treat that heifer calf as a risk as well, because I know there's actually a much higher chance that that calf is infected too. So that's where we get to that, or that tracking back of families as being important as well.
Yeah, I mean, I'd just like to add that I think it's really important, this identification of high risk animals. Quite often we hear a comment, oh, well, I just tag my red cows. Well, no, you should tag any cow that tests positive, should be clearly identified as a high risk animal. Any calf born from a positive should be tagged as a high risk animal. It doesn't mean you have to cull them. It just means you have to think before you either breed them or do whatever with them. So, you create a community of high risk animals. Your majority of herds are going to be low risk. You source your replacements for the low risk animals. You try and avoid breeding from animals with a history of a test positive. And try to avoid breeding from animals that have been born from a dam that's infected. Because when Karen did her work in the herds that she studied, over half of those animals were being affected from that dam association, from dam to calf. So, it's so important that you identify those at-risk animals. And so that's an area I would like you to discuss with your vet, to make sure you're segregating and identifying the right animals, because that's a common mistake.
Thank you. There are a couple of really good questions, but I am aware we've got 4 minutes left on our 1.5 hour webinar. It's flown by, really. We will answer all of the questions in a frequently asked question document, I suppose, and sit that on the Action Yonis website. What's been really interesting, I think, is that actually not many of the questions have been about the phase 3 tracker changes. It's about Yonis and managing it, because people are interested in it, I guess. I would just like to take the opportunity to thank you three and all of the teams behind you guys, because I know a lot of people put an awful lot of work in, because you're very dedicated to reducing national Yonis levels. So thank you very much for giving up your time today, and to the people on the call as well, because you've given up your time to listen. I think the key for me is use this opportunity to refresh your strategy. Sit down with your vet. The vets have got a new little bit of training, so they'll be really enthused, hopefully. So use this opportunity to say, am I on the right framework? Am I doing the right things? Maybe I do need to change because I have improved my data. So just use this as an opportunity to go back to the farm and kind of refresh, I think. Please don't forget to do the survey that will come up at the end. But I think we are 3 minutes off 1:30. Thank you all very much. I hope you three have enjoyed discussing Yonis as much as people have enjoyed listening. And there's a slide up there just about some links to some other webinars we've done, the website, and how to access the tracker information. And there is an email address for the Action Yonis team that will come through to us at AHDB, and we can answer some of your questions too. And there is an event that's happening with Nantwich Vets, and there will be a series of events happening across the summer and into the autumn on managing Yonis on farm, for sort of those different stages of the process that people are up to, really. So thank you very much, and thank you for listening.